For the growing number of folks in Southern California, San Diego to be specific, who are receiving assistance from Medi-Cal and also are enrolled in Medicare, there really has not been a better time for Medicare plans that are Medi-Medi. That is to say, they are designed to fit specifically for those folks who have both Medicare and Medi-Cal. So today, we're going to be talking about my 5 Medi-Medi plan picks for San Diego in 2025. Hi, Michael, and this is Michael's Medicare. Any of you or somebody you know is trying to figure out what is that best Medicare option for them this AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. So first, let's talk about, in general, what makes Medi-Medi plans sort of unique within the special needs Medicare Advantage plans. Because in the past, many of the Medicare Advantage plans out there sort of design their benefits and plan structures around the general audience. And if those folks had Medi-Cal eligibility or not, well, they could get the plan, but there wouldn't really be any special considerations for someone who has both Medicare and Medi-Cal. But over the last few years, we have seen way more Medi-Medi plans or D-SNP plans specifically start to come out. And I think it has to do, obviously, with money that the insurance companies want to make, being able to capitalize on this specific segment, but also the number of folks who are starting to be eligible for both Medicare and Medi-Cal, maybe because Social Security benefits are getting weaker, or folks are working less, or any number of societal reasons. But one thing is for sure is these Medi-Medi plans seem to be multiplying. And I think it is a big help for someone who has both Medicare and Medi-Cal, who stand to make the most of the plans that offer the most to folks who have both Medi-Cal and Medicare. So first up today, let's talk about one of the longest established rolling D-SNP Medicare Advantage plans in San Diego. No? Guys and dolls? Anybody? Maybe not. Either way, Blue Shield is obviously one of the largest health insurance providers in the nation, to the point, I mean, it really is a household name. It would probably be in the top 5 of anyone's answers if you jumped out of a bush and asked them, what is the name of any insurance plan? That being said, Blue Shield has a Blue Shield Total Dual plan, which is available in San Diego in 2025. And keep in mind, there are costs that you will see here on these benefits, but those costs, if someone does have full Medi-Cal, so no share of costs, but just the full Medi-Cal, those costs will get paid by Medi-Cal. So this means that, as per usual, pretty much all the costs for healthcare, not for medications necessarily, but for healthcare services are going to be set at that $0 copays, $0 coinsurances, and of course there is no deductible or monthly premium that would be paid. So that is all around good, but also it is sort of standard on Medi-Medi plans. That's kind of how they work. But where are some of the other great things that set the Blue Shield Total Dual plan apart from the other D-SNP plans in San Diego in 2025 are things like the $1,500 a year hearing allowance. That is yearly, not every 18, 24, or even 38 months of waiting periods. Furthermore, there is a healthy grocery allowance that is available at a $50 per month allowance to buy healthy foods by the beneficiary. So that's basically $600 a year, if my math is correct, and sometimes it is, that they can use for veggies and fruits and food that is healthy. Last up, there are many other great benefits on this plan, but I want to note here for folks who are diabetic and use insulin to help manage their diabetes, insulin is going to be covered at a $0 set copay. Because even if someone does have both Medi-Cal and Medicare, when it comes to prescription medications, not all of those costs are covered by Medi-Cal like they are with doctor visits and other healthcare provisions. So having a $0 insulin benefit can be a really big savings for folks who utilize it. Next up is going to be a plan that will be very familiar to folks who have had Medi-Cal in Southern California, because it comes from one of the most common Medi-Cal plans, at least under the 65-year-old plans, which is from Molina. Now, Molina is a California-based plan and started as a health plan that is basically specifically working in the Medicaid or Medi-Cal market for a long time, and just recently launched its Medicare line of business. And that includes this next plan, which is the Molina Complete Care D-SNP plan. Now, the benefits on the Molina Complete Care plan available in San Diego in 2025 are pretty good, especially with some of the additional non-Medicare covered benefits that are included. But first, talking about the healthcare benefits, of course, it's going to have $0 copays for doctor visits, specialist visits, 0 monthly premium, and 0 deductible if someone has both Medicare and full Medi-Cal. But additionally, it includes up to $2,100 worth of benefits above and beyond the normal healthcare. What I mean by this is the fact that it has an over-the-counter benefit of $100 a month that can be used to order things that normally someone would buy at the pharmacy but doesn't need a prescription for. So that could be a number of things that are available. Really, there are a lot of things that are available, but it'd be things like Band-Aids and bug spray and toothpaste and dental floss. Those kinds of things that are all going to be available on that over-the-counter benefit and would normally be bought anyways, so have an extra $100 towards it, save you a little bit of cash. In addition to that though, there is a $75 a month grocery benefit that can be used every month to buy healthy foods, veggies and fruits and healthy foods. For teeth to go along with the Medi-Cal coverage that comes with someone having Medi-Cal, if somebody is enrolled in the Molina Complete Care Plan, they will also be able to use up to a $1,000 yearly allowance above and beyond the Medi-Cal benefits on comprehensive and more extensive dental procedures that Medi-Cal sometimes is more limited on covering. Lastly, for this plan, I want to mention that the drug coverage is at $0 for all tier levels, 1, 2, 3, 4, 5, which is low-key probably one of my favorite benefits on this plan. It just makes the whole process much easier and means less cost for the beneficiaries out of pocket. This next plan is one that I think is going to be a big hit this year with our clients for a couple of reasons I will get to here in a moment, but it is the Scan Strive plan. Now, the Scan Strive plan is a unique setup because it is two types of special needs plans all rolled together into one D-SNP plan designed to take advantage of a person's Medicare and Medi-Cal eligibility, but also it includes a C-SNP plan, which means that they have folded in benefits for those folks who have specific chronic health conditions, primarily diabetes and heart disease, which, let's face it, is basically almost everybody. Now, because the Scan Strive plan is for folks who have chronic health conditions and have Medi-Cal, if someone fits both of these classifications, it'll be one of the unique plans that Medicare beneficiaries can enroll into all year round, even if it is outside the AEP period. This is one of those big changes that is coming in 2025 as a result of some new medical rules. So it's got that going for it for sure. In addition, the benefits are quite good as well. Of course, the doctor's visits, the premiums, the copays are all going to be paid by Medi-Cal, so $0 for all of those things, as long as someone has both Medi-Cal and Medicare. But due to the fact that the plan is a C-SNP plan as well, even if someone loses their Medi-Cal eligibility, they can still keep this plan, assuming they still have that chronic condition, but it would be very, very expensive without the Medi-Cal help. And probably a professional in most situations would recommend a different option if that is the case. So if they just have the C-SNP but don't have the Medi-Cal anymore, it's going to be real expensive. But nonetheless, it is possible to maintain. Also, the Scan Strive plan has a very generous dental allowance benefit that can be used above and beyond the services that come with the Medi-Cal that's standard with Medi-Cal, which is at a $2,000 a year allowance that can be used for comprehensive dental benefits. There are also vision benefits up to $350 a year for frames and contacts if you need those kinds of things. And one other sort of unique benefit to this plan, I'm imagining because it focuses on the chronic healthcare issues, is the availability at $0 of a continuous glucose monitor. You know, there's those little plastic like dental floss size things that folks put on their arms and they wear them sometimes so they can see, you know, I guess monitor the glucose, obviously, continuously. But really, it does help someone understand how their health changes and how their glucose changes throughout the day. The fourth plan on my list here is going to be a relatively unheard of newcomer to the Medicare Advantage world, at least in San Diego, but is now under the Molina Insurance umbrella and actually took over where the brand new day plans left off last year, which is the Central Health aptly named Medi Plan number 1, which, let's face it, it doesn't mince any words about what it does, and I kind of like that, yeah. So if you're not yet getting with the rhythm of the Medi plans, let's go over the normal healthcare costs again on this plan, which is $0 for doctor visits, $0 for premiums, and $0 for deductibles. And really all the healthcare services are going to be $0 as long as someone keeps full Medi-Cal. If not, all those costs come flooding back in. So that is good, but when we get into the differentiating benefits on this plan, the first thing that I noticed at least is a very outsized hearing aid benefit, which is at $3,000 and can be used every single year. Now, I know that sounds like a lot, and it is a lot, but hearing aids can be real expensive. So it is good, and it helps, and it is nice. Furthermore, it does have comprehensive dental, but it is much more limited than some of the other plans. And there is a pretty good over-the-counter benefit of $175. But also contained within the OTC catalog is a herbal catalog as well, which, I guess they're not quite groceries, but you might be able to get some oil of oregano, I guess. Last up today for these Medi plans that are available in San Diego in 2025 is going to be another scan plan. And the reason this one is arguably the most Medi-est of all the plans available in San Diego in 2025 is because it is the only fully integrated FIDE plan. Now, why this matters is twofold. First is because the fully integrated plan doesn't have that messy arrangement where somebody has both Medi-Cal and Medicare, halves of their coverage, run by different insurance companies. This is situations that often leave beneficiaries in a way where neither health plan is communicating very well, especially when you need services and then, the county gets thrown into the whole ring and everything goes cattywampus. But because the Scan Connections plan is a fully integrated plan, both the beneficiaries' Medi-Cal and their Medicare benefits come under one roof, under one single plan, Scan in this case. And this tends to make things run a little bit smoother when both sides of the aisle are able to communicate without the bureaucratic and privacy protection barriers slowing everything down at the whole process. To go along with that is the standard set of $0 costs for Medi plans that we've seen on all the other ones. But there's also things like respite care to give caretakers a break if they need it, as well as gym memberships, transportation, and even something called Brain HQ, which is a series of exercises and games that helps folks work out their brain to help keep them healthy. Me, I just look at and understand and review insurance plans, and that keeps my brain moving. So there you have it. That is my list of 5 Medi plans available in San Diego in 2025. And I think, as I said at the beginning, a lot of Medicare Advantage plans are really starting to take notice and put together plans and benefits that focus on the specific care and needs of folks who are on Medi. And this is great, especially when we look at how the cost of healthcare is going up. But moreover, the cost of everything is going up. And some of the traditional ways of helping lower income, fixed income seniors, things like Social Security, are not really going up at the same rate and at the same cost as the cost of living. So having a plan that has these extra benefits like money for groceries or OTC or transportation are great ways for folks to not have to spend some of that money on their healthcare and can use it for the cost of living. That, coupled with the $0 cost for healthcare, the full private networks that Medi-Cal beneficiaries get access to above and beyond what they have with Medi-Cal, means that the Medi plans are going to be a powerful option for those who qualify in 2025. All right, so that's it for today's Michael's Medicare, and I really hope that you enjoyed this video, and actually all of our videos. And if you or somebody you know is trying to work their way through these or really any other of the Medicare mysteries out there, please feel free to reach out to us at the information down below, and me and my team will be happy to assist over the phone or in person at one of our many Southern California offices in English or Espanol. So for Michael's Medicare, of course, I am Michael, hoping that you have a great rest of your day, and goodbye.